All right, let's talk about those moments in the emergency room where you have to solve a mystery in minutes, not hours. Today, we're cracking a code that helps you do just that. We're diving into toxidromes, and you're going to see how recognizing these key patterns is the secret to figuring out a poisoning when literally every single second counts. So picture this. The ambulance doors burst open. You've got a patient with an altered mental status, but there's no history, no pill bottle, no clues whatsoever. The clock is ticking, right? This is exactly the kind of high-stakes scenario where knowing the patterns we're about to talk about can absolutely change the outcome. And the key to unlocking this whole mystery? It's the toxidrome. I mean, the name pretty much says it all, right? You take toxic, you add syndrome, and there you go. It's this brilliant concept that takes a chaotic mess of symptoms and groups them into a predictable pattern that points you right to a specific class of toxin. It's like a roadmap. Now, what's so cool about this is that it's just pure pattern recognition. If you're in medicine, you already do this. You know how to look at an ECG and see way more than just squiggly lines. You see a STEMI, you see pericarditis. Well, toxidromes are the exact same thing, but for toxicology. You're basically training your eyes to see the entire clinical picture, not just one little symptom here or there. So why get good at this? Why does this pattern stuff matter so much? Well, this isn't just some academic thing to memorize. Recognizing these patterns is the bridge that takes you from a fast diagnosis straight to life-saving action. Let's just quickly break down why this is such a game changer. For starters, it radically speeds up your diagnosis. Then, it guides you to the right treatment right away. Think giving naloxone for an opioid overdose. And this is huge. It helps you avoid really dangerous mistakes. You know, like giving a beta blocker to someone with cocaine toxicity. That can be fatal. And of course, for anyone studying for exams, this stuff is pure gold, super high yield.
Okay, you ready? Let's get into the nitty-gritty. Think of this next part as your field guide to the 5 most important toxidromes you are absolutely going to see.
First up, we have the cholinergic toxidrome. The classic way to remember this is the mnemonic dumbbells. Basically, the patient's body is in total overdrive. Everything is wet. They're tearing, they're salivating, they're sweating. It's the signature pattern you see with things like organophosphate pesticides or even nerve agents. And now let's talk about its complete opposite, the anti-cholinergic toxidrome. You've probably heard the famous rhyme, and it tells you everything you need to know. Hot as a hair because of the fever, dry as a bone because they can't sweat, red as a beet from flushed skin, blind as a bat from huge dilated pupils, and mad as a hatter from delirium. This is the pattern for things like antihistamines or tricyclic antidepressants. Okay, next up, let's put 2 that are super easy to confuse side by side, opioid and sympathomimetic. As you can see, they are practically mirror images of each other. An opioid overdose slows everything way down. You get CNS and respiratory depression and tiny constricted pupils. But a sympathomimetic overdose from something like cocaine revs everything up, agitation, hypertension, and big dilated pupils. Seriously, if you're ever stuck, just look at the pupils. They're often the biggest clue. And last but not least, we have the sedative hypophonetic toxidrome. Now, this one can be a little tricky. You'll see clear signs of central nervous system depression, slurred speech, maybe they're really sleepy, but their vital signs might look surprisingly normal. That specific combination is the classic picture for an overdose on things like benzodiazepines or alcohol. Whew, okay, we have covered a lot of ground here. So if you're going to remember just one thing from all of this, what should it be? Let's boil it all down to the one golden rule. This is it. This is your ultra-concise exam line, your clinical mantra, all of it. A toxidrome is a recognizable pattern of signs and symptoms that points to a specific class of toxins. It's really that simple and that powerful. So we'll leave you with this idea. Toxicology doesn't have to be some giant, unsolvable mystery. By learning to see these patterns, you're giving yourself a massive diagnostic shortcut. So the real question is, now that you know how to spot them, which one are you going to see first?